At Liberty Mutual, we believe progress happens when people feel secure. That's why we exist to help people embrace today and pursue tomorrow.
Liberty, 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 liberty.
You're first. First to respond. First to put others' lives before your own. And in an emergency, you need a network that puts you first. That connects you to technology, to each other, and to other agencies. Built with and for first responders. FirstNet, the only congressionally authorized wireless network for first responders. Because putting you first is our job.
Hello, everyone. My name is Courtney Sanders. I'm a policy analyst with the State Fiscal Policy Research Team at the Center on Budget and Policy Priorities, and I'm joined with my colleague, Erica Williams, Vice President of State Fiscal Policy. We are excited to speak with you about today about the history of state fiscal policy and our recent paper, 3 Principles for an Anti-Racist, Equitable State Response to COVID-19 and a Stronger Recovery. Thank you for the time that you have with us today and the important work that you all will do in the coming year to advance racial and ethnic equity and justice. Now I'll pass it off to Erica.
Thanks, Courtney, and hi, everyone. As a policy matter, we know that white supremacy and structural racism have created and continue to perpetuate disparities in power, resources, and opportunities in ways that systematically disadvantage communities of color, preserve the privilege of an elite, largely white class, and undermine our collective well-being. And in some cases, tax policy rules that limit our ability to raise the resources we need to invest in shared opportunity. Those limits that exist today were directly born from the desire to establish white supremacy and maintain it, and explicitly so. In response to the short-lived Reconstruction era, during which alliances of Black freedmen, Northern abolitionists, and white people unaligned with former slaveholding elite took power in the former Confederate states, and they sought to raise taxes to make really desperately needed public investments and to rebuild the South after the war. And they were met with a swift and very dramatic response. The so-called Redeemers swept back in, retook control of state government, and installed into state constitutions harsh limits on raising revenue, and some of which. So, for example, in the post-Reconstruction era, wealthy white landowners in Mississippi demanded and won a constitutional requirement for a 3/5 vote in both houses of the legislature for all state tax increases. And it is the oldest such requirement still on the books today. Delegates adopted the measure at a state constitutional convention in 1890, the same convention where they disenfranchised nearly all of the state's Black voters, and many poor whites as well. Referring to his fellow convention delegates, the delegate who introduced the supermajority requirement stated, "All understood and desired that some scheme would be evolved which would effectually remove from the sphere of politics in the state the ignorant and unpatriotic Negro." And, while he was referring to the convention's aim of stripping political power from Black people, the supermajority requirement that was put into the state constitution and that delegate championed was part of that strategy, was part of the strategy to strip political power from Black people, and added further to the barriers that Black folks and a lot of other communities faced and continue to face today in advancing the kinds of policies that would make public investments in things like schools and healthcare and other services that people really need. And so decades later, you have a constitutional provision on the books that seems race neutral, while other constitutional measures that were adopted at that same time ultimately were stripped out because they were deemed unconstitutional, rules around voter suppressing the vote and so forth. But supermajority requirements and many other restrictions like that in southern states remained in place because they're seemingly race neutral when in fact they're not. And all of that history is sort of what builds up to the moment we're in today, where we face a really existential question of who we want to be as a country, how far we're willing to fall, how much hardship we're willing to allow for, how long we're willing to ignore or exacerbate longstanding inequities built into our systems. It's also a moment where there's an opportunity to take a leap forward if we make the right policy choices, if we build the public will for an anti-racist and equitable approach to the crisis that we're in right now and the recovery that we want. This crisis has laid fully bare the ways our nation's history of racism, bias, and discrimination are actually hardwired into all of our systems, into our health system, our social and economic systems. So we're going to talk a little bit about what the landscape looks like today, and then with the racially disparate effects that we've all witnessed, and then Courtney's going to lay out the 3 principles that we've put together for an anti-racist equitable recovery, and with some examples from what's happening in the States. I know you all know that it's a tough time to confront all of this. States face big costs as they seek to contain the virus. We don't have our hands around it yet. And as more people turn to Medicaid, to unemployment insurance, other forms of assistance trying to meet their basic needs. And at the same time, we know that revenues have taken a deep dive, right? We're looking at shortfalls of at least $300 billion or more through June of 2022. And prior to the crisis hitting, we weren't ready for this. Just a third of states had the reserves necessary for a moderate recession prior to the crisis. And a moderate recession is clearly not what we're in. We know we're not likely getting any state fiscal relief this year that would minimize public employee layoffs and cuts to key drivers of state budgets. Our K-12 school systems, our system of higher education, healthcare, and economic supports for families and communities. We know that states and localities have furloughed or laid off over 1 million workers since COVID hit, eclipsing the number that were lost during the Great Recession. And the effects of this crisis are incredibly uneven. People of color have disproportionately experienced more infections and hospitalizations, and among Black people in some Native communities, highly disproportionate death rates. Black and brown people are also overrepresented in the jobs that put them at higher risk of infection and in the jobs hardest to hit economically. We can see the divergence right now in how well-educated and largely white people are rebounding, and people in other sectors are hit very hard. You can see here that Black unemployment is much, much higher than unemployment for white workers. And if you take a look, 5.8% unemployment prior to the crisis is really not that much lower than white unemployment now, right? Rivals it. So the effects are really uneven. And behind all of this are, the other way they're uneven is just how folks are experiencing hardship. You can see that Black and brown folks are more likely to report that folks in their households are not getting enough food. They're more likely to report that they can't pay their rent. They're more likely to report that they're unable to meet basic household expenses. And behind all of this are structural barriers, like I said, that already existed, like wealth and income disparities, inadequate access to healthcare, and racial discrimination built into our health system. Factors that had already resulted in Black and Latinx people being more likely to earn poverty wages, and women, especially women of color, disproportionately represented in low-wage work. That has left them also more likely to pay a higher share of their income in state and local taxes than white households, because they are overrepresented among the, the bottom quintiles here, the bottom quintiles of households. Structural factors that led to white households in this country owning 87% of all wealth, and the top 10% of white households owning 2/3 of all wealth. So we're looking at longstanding issues that make this moment much more dire.
Yes, and to that point, I think all of that is to say that states have critical choice points and choices to make at every turn. They can repeat and exacerbate these inequities, which we know will do damage to the economy, or they can set another course towards an anti-racist, equitable, and economically more progressive recovery that extends to all people and sets everyone up for a better future. Because the reality is that we can't go back to normal. In fact, we know that normal doesn't work for Black and Brown communities, immigrants, and Indigenous people, for people stuck in low-wage jobs, like Erica mentioned, who are all too often kept from seeing our kids, our families, and our communities thrive. Normal really just doesn't work for the economy writ large. And as we leave so much talent and potential untapped and on the table, by under-resourcing and underserving these large swaths of people, whether that's Black, Brown, and white, we are still going to be at a loss. So, and normal also just leaves us more vulnerable for crises like the one we're in right now. And the choices we've made in the past are requiring a more robust response in the response. And that's why we laid out these 3 principles for an anti-racist, equitable state response to the crisis. And I will walk us through that. And so the first is to target aid to those most in need due to COVID-19. The second is to advance anti-racist and equitable policies, both in the short and long term, to dismantle all the things that Erica talked about. And then the last is to protect state finances, to preserve foundations for long-term economic growth and opportunity. So I want to start with the first one, which is to target aid to those most in need right now. You know, states' immediate policy responses should prioritize supports for people and communities most in need due to the pandemic and the economic downturn. They should target aid to essential workers, the folks that we call on the front lines, and people who, due to lack of public investment and economic inequality, are historically currently and historic and current discrimination and bias, we're experiencing the health and economic insecurities now. And that includes those who have chronic health issues or without health insurance, and people who experience homelessness, and others facing major barriers to work or struggling to make ends meet. And so, you know, people right now, one of our top recommendations talks about housing, right? And people without a place to call home are among those that are struggling the most right now. On any given night prior to the pandemic, nationwide, over 50,000 people were experiencing some type of homelessness. And many are and have been at risk of contracting and dying from COVID-19 because they have maybe pre-existing conditions or they're older adults. And so what lawmakers can do right now, and what they started, but we see even at the federal level, there was, you know, these expiration dates that have not been renewed, which is thinking about freezing evictions across the board. And that's for now, and as long as the economic conditions demand, to prevent more people from losing their housing, pulling up with families and other people, which we know if we're asking folks to socially distance, that's the opposite of what we need to do in order to make sure that we're having a more healthier as well as stronger economic recovery. And before the pandemic, about 75% of renter households with annual incomes less than $15,000 paid over half of their income for housing. And children make up about 1/3 of the renter households that are paying over 50% of their home, of their income in housing. And so the response should not be to evict people back into the streets or into shelters, but freezing evictions while people can get back on their feet, so that we can prevent from having much more homelessness in the long term. And I want to just kind of highlight a few examples of what other states are doing and how they are thinking about addressing the immediate needs. So in DC, they made new investments in homelessness prevention and in affordable housing. In New Jersey, they removed a racist cap on TANF for large families and expanding cash assistance under the Temporary Assistance for Needy Families, TANF, policy. That was one of our recommendations, right, to help families with persistent barriers to work, and how states can increase their cash grants and lift TANF income thresholds and expand the eligibility, right, and eliminate restrictions to assistance such as work requirements and other time limits that are attached to some of these public services. Massachusetts TANF coalition has repealed the TANF cap and other requirements to access cash right now during COVID-19. And then we have states like Colorado, New York, Michigan, and Pennsylvania who expanded the use of emergency Medicaid for COVID-19 related testing for all, regardless of immigration status. So it's not just about who needs it, but it's about who's also being left out. And so that's just something that, state lawmakers can really think about. And then voters in Missouri and Oklahoma ushered in a Medicaid expansion. And that, again, that's another one of our recommendations, how states can adopt Medicaid expansion, extend healthcare to people who are undocumented, because we know that 15 states there are about 15 states that have yet to take up, the Affordable Care Act Medicaid expansion. And so they should do so now to ensure that over 4 million people across the country have health care insurance during this crisis and during this pandemic right now. Texas enhanced worker protections and addressed the unmet needs of the state workers during the pandemic, which is a great move in the right direction as we look at the new elected leaders for the 2021 election section to think about how we can build upon that. And then in New Mexico, the governor helped make childcare available in some of the state's essential workers by compensating providers. And she also ensured that childcare workers that were uninsured could get, some type of health care they needed if they contracted coronavirus. Also, just lastly, in Florida, after the November election, we saw that Florida voters this month approved a gradual increase in the state's minimum wage to $15 per hour by 2026. So again, these are the immediate needs that states can look at as we move forward. But the second principle is also talking about how do we advance an anti-racist and equitable policy, both for the short and long term, to dismantle, persistent racial, gender, and economic inequities and inequalities that non-dominant groups and identities experience, because states can use this moment to address inequities due to all the things Erica shared, the historical racism and various forms of ongoing bias and discrimination, because we know that racism and other structural barriers to opportunity have created these underlying social, economic, and health conditions that have left people of color, especially Black people and women and immigrants and tribal nations, particularly at risk of the coronavirus infection, and in the case for Black people, death. And Erica mentioned this, so I won't belabor the point, but the Black unemployment rate is roughly still twice as high as white unemployment rate on average over time, and it's not much better in the best times than white unemployment rate is in the worst times. And so I think it's important for us as lawmakers to think about what that really means. So states should push against these trends in so many various ways. We have a few examples. For example, Maine, they established an independent permanent commission of the status of racial, indigenous, and Maine tribal populations. Again, just really focusing on the equity piece. And as far as unemployment, Georgia and allies worked hard to extend UI benefits. And in Kentucky, we also see that they can, secured some type of removal of barriers for UI programs there. States and localities also have a heavy reliance on fines and fees, which undermines families and their well-being. And so in the midst of a pandemic, states and localities should discharge all outstanding fees and fines and court debt or at least stop penalizing and jailing individuals for unpaid fines and fees. And in that same vein, really think about, as lawmakers, where you are raising the money. And states should stop suspending driver's license for unpaid fines and fees, because we know that millions of Americans get trapped into this justice system simply because they can't afford to pay their fines and fees, and stuck in a cycle of punishment and poverty, and people can lose their jobs, their homes, and even their children. And so this way of collecting revenue does more harm than good, both in people's lives and in the state fiscal budget. And the collection of fines and fees is also unsustainable. It's not going to get us through the recession or economic recovery. And it presents more revenue challenges than profit, according to a study by the Brennan Center. Therefore, states and localities should stop this. In fact, in California, we saw that a repeal of 23 criminal administrative fees that were enforced at the county level, such as probation fees for public defenders, and forgiving $16 billion in debt for low-income families of color. So a state should adopt a more progressive way of looking at how to address fines and fees. The other thing is to adopt and expand their own, versions of the federal EITC, including increasing the credit size and expanding them to workers without Social Security numbers, largely immigrants who are undocumented. We know that there are 23 states, Washington, D.C., and Puerto Rico, to follow the federal practice of offering a fully refundable EITC. And so other states should continue to do that. California, Oregon, and Washington have relief funds for undocumented workers. In Oregon, they set aside about 20 million, Washington 40 million, and California 125 million through the public-private partnership. And additionally, California and Colorado also extended their state EITCs to undocumented workers. Finally, we have the last principle, and that principle talks about how do we protect the state finances to preserve foundations for long-term economic growth and opportunity, because we know that state budgets face severe and mounting pressure from so many different things, COVID-19 outbreak and the economic fallout. And so without substantial additional federal aid, states will cut services, and what they choose to cut will have significant effects on equity. During the Great Recession, we saw, for example, that states made deep cuts to, really core public investments, including assistance to K-12 education, public systems of higher education, infrastructure, transportation, and the economic supports for struggling families and communities. And as they did this, they laid off teachers and other public employees and set back needed investments in people and communities, therefore, slowing down the recovery. And while these policy choices made life harder for many people across the racial categories, people of color felt it the most, right? In part because of historical racism and modern day discrimination, often that left them with little wealth to draw on in hard times and living in neighborhoods where schools and other public infrastructures were already weak. For example, Black households' median net worth fell 3 times faster than white households between 2005 and 2009, when the housing values plummeted and the recession struck from that time. And so one thing we can continue to learn from every economic downturn is that states have choices, right? They can cut service, often in ways that harm families most in need, or they can raise revenue. And so we talk a little bit about what states can do. States should raise revenue, especially from profitable corporations and the wealthy. That's a racialized choice given the country's history and ongoing biases that Erica discussed today. We know who holds the wealth in this country, right? And so additionally, tax increases are particularly a good option for states that are, needing to close those budget shortfalls in the bad economic times, especially when those measures target wealthy households and those whose consumptions is least affected by the economic downturns. And, while we're thinking about that, states should remove some of those revenue-raising barriers, such as the supermajority requirements that were born from, historical racism that Erica talked about, and stop power for the hands of the few. Another thing states can do is just roll back the economic development incentives and other tax breaks for profitable corporations. Economic development incentives cost states about $45 billion per year in aggregate, despite evidence that they are largely ineffective. So rolling back ineffective breaks to improve economic supports for people that are hit hard, like communities of color, would also improve racial equity, and the corporations that benefit the most from these breaks typically are owned by mostly wealthy and white shareholders. And so what are some examples of some of that already happening or being done? In New Jersey, they just recently adopted a millionaire's tax and a corporation tax surcharge. In DC, they closed several corporate tax loopholes. And there are many states that have spent down their rainy day funds, right? And so if all else, think about what your rainy day fund looks like and how you can take opportunities for that. That's our three principles, and I'm going to switch it back over to Erica.
Thanks, Courtney. This is a consequential moment, and it seems like with each passing day, what happens in the states is more pivotal. There's still a lot of unknown at the federal level as we move into 2021. We don't know yet what kind of relief package will be possible, whether we'll be able to secure the kind of fiscal relief that states, localities, and tribal governments really desperately need right now. We don't have in the current year a lot happening on an additional relief bill. It's still possible that something could happen in 2020, but there's a pretty big distance between the vision of relief that Senator Mitch McConnell is putting forward and what House Speaker Nancy Pelosi is putting forward. And so whether that gap can be bridged in this moment is still pretty up in the air. In either case, when we move into 2021, raising revenue at the state level and making the kinds of investments and reforms that Courtney was just talking about to invest in all of our communities and make sure everyone has a chance at recovery, that's just got to be a top priority in the states. And I know there are many of you who are working in states where what we discussed seems politically impossible, maybe a really high bar. But I think it's still critically important that we all make the case for what's needed, that we shape and drive a narrative for the future that we want, and we put forward the policies that can get us there. Achieving an anti-racist, equitable future is something we want to push on now, but we know that it's also long-term work, and it's going to take a lot of us doing it and calling for it. What we choose to do right now is going to have implications for decades to come. And if we are not intentional about undoing past harms, we're at best maintaining the status quo, or at worst, we're exacerbating the harms of past discriminatory policies and practices. We know that policies and systems are self-reinforcing, and so if you want a different outcome, you have to intervene. I think the good news, I'd like to leave you with some good news. The good news is that if intentional policy choices can create persistent inequities, then intentional policy choices also have the power to break those structural barriers down, to uproot those inequities, and to move us toward the anti-racist, equitable future we want and need. And I think this is just what we have to remain laser focused on in our current context. And you have allies in this effort. If we go to the next slide, the Center on Budget and Policy Priorities coordinates a network of 43 state and local level fiscal and economic policy shops. We're in 41 states, the District of Columbia, and Puerto Rico. And these are groups that are very much focused on creating this anti-racist, equitable recovery and future. And we really hope you'll be in touch with the State Priorities Partnership Group in your state to talk about, what you can do together and what you as lawmakers can champion in your state legislature. So thanks again for having us, and please don't hesitate to be in touch. It's been a pleasure to get to talk to you.
Having the internet has allowed me to explore my passions and create new ones. Over the last few months, I've been working on a children's book. It's all about a kid with big dreams who wants to succeed at all kinds of things. Sometimes he doubts himself. He wonders if he should be more realistic. But he works hard, he keeps dreaming big, and he goes on to achieve amazing things. It's meant to be a lesson for kids, but it's also a reminder for me to show the world what I can do.
Hi, I'm Sarah Davis, Senior Director of Patient Advocacy and State Government Affairs at CRISPR Therapeutics. As a leading gene editing company co-founded by a Nobel Prize-winning scientist, CRISPR Therapeutics is proudly working to translate the revolutionary science of CRISPR-Cas9 into potentially transformative therapies for people living with serious and rare diseases, such as sickle cell disease and beta thalassemia.